Hello everyone, welcome to my channel again. My name is Ajibola Morolake. I'm a registered nurse. To my returning subscribers, welcome to my channel and God bless you. And if you are viewing my channel for the first time, I welcome you to my channel as well. My channel is all about enlightening individuals about some health challenges which can be prevented if individuals has the knowledge to do so, and also to talk about some health condition which needs to be managed appropriately to prevent complication. And mostly I use my channel to talk about women's health. And today again I'm going to talk about a topic that actually affects women's alone. And what am I talking about today is vagina birth after cesarean section. The woman may decided to have or attempt a vaginal delivery after C-section. So today I'm going to talk about tips that can influence safely vaginal birth after C-section. If it's something that you like to know about, come along with me. Welcome back to my channel. I'm going to talk about vaginal birth after cesarean section, which is abbreviated as VBAC, or trial of labor after cesarean section, which can be abbreviated as Tolac as well. So I'm going to talk about tips that influence positive, safely vaginal birth after C-section. So you have to consider some reason. Maybe what happened during the previous cesarean section is not likely to reoccur, or there is possibility of what actually caused your previous C-section is likely to reoccur in this pregnancy or in your future pregnancy. So maybe previously you had the C-section because the baby is in a compromised state, in a distress, or because the woman is exhausted, she has been pushing for hours on the second stage of labor. Maybe that's the reason why the doctors make the decision to have C-section for you previously. But if it's like a condition whereby it's because of pelvic disproportion, because of the shape, curve of the woman pelvic, this is not going to change, and how that bone structure does not change. So if it's because of pelvic disproportion is the reason why the woman have a previous C-section, it's more advisable for that woman to have a repeat C-section. So another thing is to consider the position of the baby. Is the baby in a transverse position? If because the baby is in a transverse position, there is need for C-section, the more safer mode of delivery, or because the placenta is covering the cervix. So in a case of placenta previa, the woman have to have a repeat C-section. But apart from all these that can make a woman to have a C-section, there is nothing like that. The woman can make attempts to have a vaginal birth after cesarean section, which need to be discussed with the obstetric and gynecologist before they can make this choice. So what are now the factors to influence a positive, safely vaginal delivery? Number one is to know the woman history. The history, if for instance the woman has an history of normal delivery previously before a C-section, there is possibility of that woman having a successful, safely vaginal birth after a C-section. Another thing is that how many numbers of C-section has the woman done before. If it's more than one, this will increase the risk of that woman. So it's more preferable that a woman should attempt vaginal birth after just one C-section and history of a cesarean section, which is more safer for women to now have attempt vaginal delivery. Another factor is the timing of the delivery. So they have to time the delivery. The delivery and the labor have to come spontaneously. They are not going to induce a woman. They are not going to hang hang any medication for that woman to artificially starting the labor. The labor has to start on its own. Nobody is going to initiate or induce a woman with a previous scar, a previous cesarean section, or even a major pelvic surgery in the past. Another thing is that the delivery must take place in the hospital facility. You can't wait at home. For a woman that have previous scar because of C-section or a major pelvic surgery previously, when you are having a labor, you don't have to stay back at home. The delivery have to be monitored in the hospital facility. Another thing is that to actually deliver in the hospital, that they support vaginal birth after C-section. Before you fall into labor, before the spontaneous vaginal labor, you have to have discussed this with your obstetric and gynecologist even before labor starts. So we are going to know, maybe they are going to support the hospital support attempting a vaginal birth after cesarean section or not. That is so important. It's so important to deliver in an hospital where they support vaginal birth after cesarean section. Another thing is that is the type or nature of your incision for previous CS. There are two types of incision. One is can be transverse incision at the lower region of the uterus. There is a reason for doing that kind of incision. Another one is the vertical one that run across the uterus. So it's not about the visible scar a person can see or visible line of incision. It's based on the incision on the uterus. So it's better to deliver in the hospital whereby they have your history, or if you have your history, is so important. So if you deliver in your previous hospital, if you receive a compassionate and a adequate professional care during the time you have your C-section, it's advisable for you to deliver in that place, hospital, whereby you have a cesarean section. They will have access to your surgery history to actually know the type of incision, not the physical one that we are seeing in your abdomen, but incision on your uterus is very, very important. So incision, the lower segment incision, the transverse type, actually supports an attempt of vaginal delivery. So it's so important. Another thing is now for you to deliver in a hospital that have facility for cesarean section. If there need be for you to have a repeat C-section being done, this is very important. And another thing is, don't forget about the advice of your obstetric and gynecology. If they advise you that is not safe for you to have a to attempt a vaginal delivery, or at the course of monitoring you, they have to make a decision that is better and more safe for your baby and yourself to have a repeat C-section, yield to that advice. They have your best interest at heart. It's so important. What is now the benefit of vaginal birth over cesarean section? And most of the reason why some women prefer to have or attempt vaginal birth after C-section is that there is there is reduction of risk of hemorrhage, infection, and the woman will be able to recuperate on time, to adjust on time in order to bond with their baby, or a shorter stay in the hospital, which is so important. But that does not mean that if there is need for a woman to have a repeat cesarean section, you should not embrace that. Is so important. This video is just to empower women about their choice, their mode of delivery after having an history of C-section. So come to the end of this video. Don't forget to like my video. Don't forget to subscribe as well, and you can likewise share the video with others that you think that they will benefit from it. Until next time, I will be doing another video. Take complete charge of your health. Bye.